So I'm Dr. Geeta Perks, and I'm the owner of Dental Focus Marketing. And for any of you who know me, they would actually tell you that I have a really deep curiosity about dentists, about the journeys and the experiences of their journeys in dentistry, because I really believe that us as dentists, we have a unique story that we can share with others that so that they can learn and also maybe not to make those mistakes that we make.
Yeah.
But I am really excited today to have Dr. Damian Teo. He's the owner of the Melbourne Dental Sleep Clinic. And he's also created the study club, which is the Sleep and TMJ Study Club. So I'm really excited to learn the insights from you, Damian. And so thank you for connecting with me today.
You're welcome. Thank you for having me here. I'm very excited.
I'm
Yeah.
super excited. So I guess what I want to start with is your journey into dentistry and how did that begin? And share that with us.
Yeah, well, my journey to dentistry pretty much started with my godfather. He was a dentist here in Melbourne. He passed away, but when he was when he was practicing, he was very passionate about TMD and sleep, which pretty much paved the way to where I am today. So when I first got into dentistry back and finished high school, he took me out for lunch and he was telling me, Damon, great, you're going to do dentistry. But when you get in there, don't just think about teeth. Think about the whole person, a human being. Think about the jaw. Think about them as a person. And I was like, what's he talking about? And then when I started doing dentistry, and then he started teaching me more about sleep and jaw pain, clenching, grinding, and all that stuff. I started seeing things differently. And then when I graduated as a dentist, I just thought, no, I just want to do TMD and sleep, and went straight into that as an undergrad dentist. Yeah.
Right, amazing. That's amazing, and also to have a godfather. I mean, I had my dad who got me into dentistry, but yeah, I think it's always insightful there. What has inspired you to then become an educator in sleep and PMJ disorders?
Yeah, well, what inspired me about this was it's just felt it was a very poorly taught field for all well, not just dentists, but also medical doctors.
Yeah.
Because we see a person with jaw pain and we just think of TMD, but TMD is such a broad umbrella term and it encompasses pain in this whole head and neck area.
Yeah.
Whereas for dentists and doctors, we just think TMD is just this part. But actually, most of people with TMD is pain in the masseters. And you tell them, oh, I've got TMD, but you'll just think it's the TMJ.
Yeah.
But it's not, it's actually from the masseters. And then we don't tend to treat it properly. And that was just that lack of knowledge and education in the field, which made me really passionate to like broaden it around and make it easily accessible for dentists everywhere.
Yeah.
So that's basically why I started with this. Yeah.
It's great. So you saw that there was a gap in the education for dentists, and then you expanded on that so you could address that.
Yeah, because a lot of dentists would ask me, like, how do I treat this or where can I learn all this? And when I was learning all this, most of it was from my godfather, and he learned it all from overseas. And then the courses and mini residencies I did were all from overseas educators. They were from USA, UK, a few in Australia, but most of my mini residencies and TMD training I did was from overseas courses.
Right.
So there are courses in Australia, but they didn't teach it to the same extent. And most of it felt like it was just make a splint, cut plain splint for everyone to put in, but there wasn't anything more other than that.
Yeah. So I guess if there are dentists out there that are wanting to learn these skills that you have, like what is unique about your course?
Well, I like to combine the TMJ with the rest of the body and holistic health. So a big contributor to all these TMJ problems we see is sleep apnea and snoring, which is definitely making a huge rise in dentistry today. And lots of dentists now are starting to learn that sleep apnea is something that dentists can treat by making mandibular advances. But then they don't also realize that lots of people with TMD have sleep apnea. And lots of people with sleep apnea have TMD. And then when you look into like the comorbidities of sleep apnea, most of these people can have a high blood pressure or difficulty sleeping, hormone issues, like low thyroid, diabetes, etc. And these are all conditions which can also be comorbid with TMD because they have a chronic pain condition and then it affects the rest of the body and it starts deteriorating. So there's this big overlap with lots of general health issues, which is what I found was lacking in most courses teaching TMD. They would just say, oh, just make this splint that I use all the time, adjust it like this. Whereas when I run my residency, the main thing I wanted to do was not just have me teach everything. I wanted to have physios and chiropractors and ENTs and sleep physicians and orthodontists and every sort of modality to come in to talk about how they contribute to help this condition.
Yeah.
And that's because the reality is when I treat my patients, most of my treatment is talking and referring and sort of treatment planning who to refer to. And then I still make a splint, but it's also like, okay, I'm going to make you the splint, but you need to see this physio or see this ENT, do a sleep study, maybe just acupuncture as well. And that's basically where we go.
We'll come to that. Yeah. So you're not only an educator, you're also a practice owner.
Yes.
So tell me a little bit about that journey into practice ownership and what sort of challenges you do have in practice ownership you face?
Well, the biggest challenge was stopping being a dentist. Because we're so good at being dentists. We've been taught about for years how to do composites and fillings, etc. But we're not taught much about the business or how to run it, how to look after staff, wages, and things like that. So, and it really is about trial by fire. Unless even if other people tell you and teach you, you still don't understand until it happens. And oh shit, I've got to pay this person or something.
And so, how did you overcome all of those challenges that you faced?
It was basically just taking the plunge, and well, I did get in touch with quite a few different companies, such as yourselves, Dental Focus Marketing. And I did talk to some of my my mentors, like my old bosses and other friends who own practices about what they did, who they used, advice on like, what should I buy, what should I do, etc. So yeah, most of it was just asking lots of advice from lots of different sources, just from most of word of mouth or Google and looking
and just learning, right?
Pretty much, yeah.
If you were to do it all again, and you go back in time, would you do things differently, or would you still do everything the same?
I think I would still do things the same because I'm pretty stupid that sort of way. I don't really learn from my mistakes that easily. Most of it, I haven't really thought about that question before, but thinking of it on the spot here, I don't think I would. Knowing me, I'll probably just do the same thing I did and like just ask around, try things out. I have to try it and see it work or fail to understand it. Even if someone tells me it's not going to work, I say, I see what you mean, but I still need to try it and experience it myself to get the full impact. And even if it could be a bad result, I still chalk it up to experience. Like, oh well, I've learned something. Now I know I'll never do that like that again.
So I guess. Okay, if there was a new graduate that's just graduated today, or even if there's general practice owners who have been working in dentistry but just want to excel in those skills that you have, what is your advice to them?
Well, with dental practice ownership, I would definitely say if you're already considering it, keep following and pushing things. Like don't think it's like some of my friends I've known, they've looked into it and they say, oh, actually, no, this, I don't like this, I think I'll just push it aside. But if you've had that, I've always thought that if you had that thought of doing something in your mind, it sort of plants the seed and you just want to keep watching till it grow. But if you keep thinking of like, oh, no, it's not going to work or this, like that, like that's why I keep saying like I just want to try it anyway. And if it doesn't work, it's like, well, sure, it didn't work, but I learned from it, but it still gained something from it. So my biggest advice would just be, I think the biggest problem for biggest fear for all business humans is just like taking that first step of trying something new outside our outside like our confidence.
Absolutely. My next question is about what you foresee is the future in sleep and TMD. It could be diagnosis, treatment, or even technology. What do you foresee in the next few years? I mean, we're here at the ADM.
I think the future will be more thorough diagnosing, and I really hope there'll be more collaborative working and holistic and multidisciplinary working. Which is why I'm basically trying to refer to dentistry.
Yeah.
It's like working outside of the dental field and said referring to different allied health practitioners, getting a good knowledge base with them and working relationship.
Yeah.
Because being a dentist, there's only so much we can do to help our patients when they have pain. And I feel disheartened when I say, oh, all I can do is make you a splint. And when I didn't know what I know now, I was feeling like, I wish I could do more. And then I started studying. I did some like physio courses and chiropractic courses. And then, this was led to me doing acupuncture. Yeah.
Acupuncture.
And
And I've had my arm done with your lasers.
Yeah.
Acupuncture without needles.
Yep,
Which is
that's right.
fantastic.
Yeah.
So I think that's part of the future.
Yeah, I definitely think going to more collaborative treatments and dentists doing more things like outside of dentistry, but still complements dentistry because acupuncture is still a medical-based treatment, and the college I'm studying in with is called the Australian Medical Acupuncture College, AMAC. And it's run for doctors and dentists only, so you have to either be a dentist or a medical GP to do the course. So most of the people doing the course with me are all medical doctors who practice on their patients, and they're not just treating TMD, they're treating like cancer and, menstrual issues and hormone issues with lasers and needles. So that's basically just where dentistry is eventually going to go. Hopefully, we'll go one day.
Absolutely incredible, and it's so exciting as
Yeah.
well. My next question is about your motivation and what motivates you professionnly and also as an educator.
Well, I just love seeing that light bulb moment when people understand it all of a sudden. Like, for example, a lot of it when I see my patients, I talk to them a lot, and most of the talking is educating them about why there's a problem and what is going on with it. And then I told them, I'm going to refer you to the person for physio. I'm going to refer you to this person for the sleep study. I'm going to do splint and acupuncture. But then they understand because they've been educated and they just really light it up. To see that in a normal patient with no dental background is so fulfilling. And then that's what I also see in dentists when I teach them. They get that same realization that there's so much more that we can offer and provide. And even though we're dentistry, we're still doing dentistry, we can still do more outside of dentistry and really improve our patients' overall health.
Yeah.
So that's basically my main motivation, just trying to spread all this knowledge and this passion that I feel and share about experiencing all this time.
You have definitely got passion, and you have definitely gone beyond the seas to spread this knowledge. And I, for one, have actually heard about you overseas in Malaysia from a dentist who knew who you were and had been to your courses. So it's incredible.
Thank you.
I think my last thing really would be, what next? What next for your passion? And in your career, and also what next for the sleep and TMA studying.
Yeah, well, at the my biggest focus now is on just providing more and more education as anywhere I can. So for the last 4 or 5 years, I've been mostly focusing in Australia. The last year and this year, I had the opportunity to go to Malaysia to run my courses, and I want to just keep expanding it and keep teaching more dentists as much as possible of what I know, especially since there's not many dentists like myself who do what I do, and especially now that I'm adding acupuncture into what I teach as well. That's another subset I see. Well, I can't think of any dental acupuncture courses either. So, that's basically my main focus in the future, to just provide more education and courses in this TMD and sleep field from not just a dental perspective, but also a more holistic perspective.
It's fantastic. And with Dental Focus Marketing, we're going to be with you in November on your course, which has sold out, by the way. As soon as we put it up there, it was already selling out. So how do dentists find out, and also allied health, I guess, so and doctors, how do they find out about your course? How do they sign up to it?
Yeah, So you can follow my Facebook. I have a pro Facebook group for dentists and doctors called Sleep and TMJ Study Club.
Right.
If you just search for it on Facebook, you'll be able to find it and join it. And that's where I post my courses, but I also post research, case studies, demos of me doing things, etc. I also have my website, the sleepandtmjstudyclub.com.au, which is where all my courses are as well, where you can register for them. And just follow you can always reach out to me by Facebook. I have lots of dentists just Facebook message me. Sometimes faster and easier than typing an email. So I don't mind people reaching out to me.
Yeah. So you're so accessible. Thank you so much, Dr. Damian. I really feel like I've learned a lot about your journey, and I think a lot of the dentists will take a lot from this. So
thank you very much.
thank you so much.
It's been a pleasure. Thank you.